Good afternoon, everyone. Welcome to PYA's Summer CPE Symposium for Hot Topics in Healthcare, Day 1. PYA is pleased to welcome you to our third annual Summer CPE Symposium. At this event, you will receive CPE credit. There are some additional steps that we will have to take in order to comply with NASBA's requests. In accordance with NASBA, attendees will be provided 3 polling questions throughout each of today's presentations. Responses are documented electronically. Attendees must respond to these polling questions within the allotted time in order to receive CPE credit for the presentation. If you encounter any issues responding to the polls, please send your answer in the questions pane and we will document them for your CPE credit. A post-event survey will also be provided for attendees to submit regarding their webinar experience. The polling questions and post-event survey must be submitted for proof of participation today. Credits will only be earned for sessions attended in their entirety. You will have the opportunity to submit questions to today's presenters by typing a message into the questions pane of the control panel. We'll collect these and address them via email after the webinar, and all of the presentations will be recorded and released with a copy of the slides after the event. Our second presentation of the day is Insights from the DOJ, Management Accountability for Effective Compliance Program. It will be presented by Tynan Kugler and Karin Anderson, both principals at PYA. And with that, I will hand it over to our presenters.
Thank you so much, and thanks for joining us this afternoon. We are grateful to be here and glad you're spending an hour of your time talking about all things OIG and compliance. As Karin said before we got on, we're going to talk about some of the nuts and bolts and hopefully share some stories along the way too. I am a principal in our compensation valuation planning and design program and work primarily in fair market value compensation valuation for all kinds of different transactions, and also do some things in our compliance practice as well. So Karin, I'll let you introduce yourself.
Okay, thanks, Tynan. It's a pleasure to be here with everybody and with you today, Tynan. I am in the healthcare consultant at PYA as well, and work a lot in regulatory compliance, privacy, and really enjoy working with clients to sort of help strengthen compliance programs and all aspects of that. And today we are talking about, let me get us to the first slide. So these are sort of our objectives today, what we're trying to cover. And basically, I think the 2 messages today really are the government has a set of criteria in which they judge us when they are looking into the practices of a healthcare company. And one of the key ingredients is the company's compliance program. So since there's some new compliance program guidance out, we want to share that with you today. Also sort of share it from the government's perspective. We want to talk a little bit about how specifically prosecutors or the government is going to evaluate the effectiveness of the compliance program. And in turn, what they do then is if you are under an audit or an investigation or a matter that they are looking into, that translates directly to the severity of really the penalty, the final settlement between the government and the company. And so it could not be more important to really bolster your compliance program. And then because we've had the opportunity for years to sort of work in this arena, this compliance arena, we wanted to share best practices a lot that we have learned from you along the way. And so we're just glad to be here with you today. A little bit about my background is I was a nurse turned healthcare lawyer, practiced for an awful long time, and my area really has long time been government investigations. So I have had the opportunity to learn also from a lot of U.S. attorneys, which is the Department of Justice, and they, in defending healthcare providers or practices or companies, they have shared their views with a lot along the way. And so we've got a good bit of insight publicly and then some privately that they've shared about what they'd like us to do. Let's see here next. Go back. Okay, so we want to talk about, like, there's a lot of sort of serious laws Tynan is really going to tackle today, like one of the most serious laws and the guidance that we have on that. But I always think the backdrop of this is most of you work at a healthcare company or practice, small or large, and what you're doing every day is delivering healthcare or some aspect of that if you're at a health insurance company or whatever, but you are very focused on healthcare activities, humans taking care of humans. And at the end of the day, there's some common business activities that you do in the midst of all of this healthcare service. And I just listed some here because these are some of the common ones that turn into violations of rather serious laws. And they can be sort of easy things that happen, right? Tynan sees this all the time. Medical director agreement. That's something you've got a special service line that you're starting a cardiology practice. You need a medical director for that. You're going to get an agreement to compensate them for their time. One of the common violations of that is paying them too much per hour or per whatever, but it takes it above fair market value. So we're going to talk about some of these laws, but so that can be a Stark violation. It also can be an anti-kickback violation. A lease, that we see this a lot, a lease for a hospital owns a lot of land. You own the campus, right? And then a hospital would lease to physician practices for their private practice that they're starting there. And you have to charge fair market value. That translates to charging a certain amount per square foot. You missed a closet. That square footage that was not in the lease, that's a Stark violation. So you didn't charge enough rent because you didn't consider that. Perhaps it's a Stark violation, let me say that. The hospital recruited a physician to the community. You're trying to bring specialists into your community. You do a recruiting agreement with that physician. They're arriving the next day. They didn't think about having furniture in the waiting room. The hospital happens to have a bunch of furniture they're not using. They're just going to throw that in there. So that's outside the contract. It might be valuable enough that again takes that to sort of too much value has been given in the recruiting agreement. It might be an anti-kickback problem, and it might also be a Stark problem. So, and then day after day, we deliver healthcare services and claims for medical services. We are billing and coding all day long. And so sometimes it is difficult to get the correct code for the services or have the documentation to support it. So a common violation would be the hospital submitted an incorrect code and received higher reimbursement, and that would be a False Claims Act. We'll talk today a lot about, this will make sense as we go along, I promise. We'll talk a lot about False Claims Act today and those violations. And that's because all these arrangements, if you violate the Stark law or violate the anti-kickback law, they'll say that the contract itself, let's take that medical director contract, is bad. And so all of the claims, let's say it was a 3-year contract, all of those claims are considered false claims now, if that arrangement did not meet the requirements of the law. And so when we say there's a Stark violation or an anti-kickback violation, that means there will also be a False Claims Act case. And so again, this will make sense in a minute, and I know you probably know that already, but we just want to make that clear. So
Karin,
oh, go ahead.
Well, I was just going to say, one of the things about that list is, none of these are really new. These are arrangements that hospitals, health systems, practices, hospitals have with other providers of services. These are arrangements that have been ongoing for years. And so it's so interesting that we still keep seeing some of these as sort of low-hanging fruit from the government's perspective, which gets back to, the strength of your program, the strength of your policies and procedures, and, sort of always making sure you've got your house in good order. So it's just, there are some new things that the government's given us guidance on, but it's a lot of the same things we keep seeing over and over and over that are still coming to the attention of the government. So.
I think that is a great point. This is just continues to be a challenge.
Yep.
And then this is just, okay, so I'm a lawyer by trade, so we don't do math. So I don't want anyone to sort of start picking apart the calculation. But this is an older US Supreme Court case. And this is the one time I saw the judge being very sympathetic towards the provider. So I wanted to share this. Plus it talked about the penalties. So we talked about any of those everyday situations could be a false claim. So this is a US Supreme Court case from 1997. And the case was one that we have probably seen before. This was a rural community. A psychiatrist had worked there long term. He was, I think, one of the only mental health professionals in a large area. It was an elderly and poor population that he treated, meaning most of them have a government health insurance program. So he's submitting claims to Medicare and Medicaid. He provided therapy sessions, usually 45 to 55 minutes, he said, is what he booked. That's code A, claim code A that he's submitting. At whatever point he gets investigated and they look back 7 years, as they do, they can look back a long time period. And they said his documentation and his medical records did not support code A, and he should have billed for code B. So for instance, he didn't have very clearly start time and end time. And again, one of the judges said, you know, this is a small town practitioner just trying to help people. They're not so worried about sort of those kinds of things in his documentation, more about the diagnosis and the therapy and treatment and that kind of thing. So that's the scene. So basically, it was a difference of like $20 in the code. But during this 7-year period, there were 8,000 claims, 8,002. That ended up being about 245,000. So the difference that he got, and that's not what matters to the government, but he was overpaid 245,000 over 7 years. But this is the government's claim based on that situation is, okay, in the False Claims Act, there are 3 financial penalties. One is you don't get to pay back the difference, you pay back all the money. So for 8,002 claims, every penny you got, that goes back. So that's step 1. That always happens. And all of you that handle overpayments, I know we have a lot of compliance professionals and officers on the line, right? We know that process of overpayment and paying back. The second part is, and it depends on we're going to talk about the company's conduct today, but it depends on the conduct of the company. How strong was the compliance program? They will take that same amount of money and then multiply it times 3. So up to treble damages. And when you're defending those claims, you know, you might argue, okay, this is more like a 1.5, you know, that multiplier that we should add on that kind of thing. So anywhere, one time to 3 times can be that. So that's a category. Another category is they can add a civil monetary penalty per claim. So again, we have 8,000 claims. At that time, that was $10,000 was the monetary penalty. And today we are more in the 14,000 to 28,000 range. So when you add up at that time, what the government this was actually tried in court and they appealed it and it went all the way to the US Supreme Court, was the government was saying he owes us $80 million. And this is, and sitting on the other side in the courtroom, if we've all watched our court shows on TV, right, is the little old psychiatrist, you know, who's works long hours a long time and is like, I mean, that is, you know, just funny money at that point. So anyway, I wanted to give you that's sort of the structure. So we have everyday things that we do all the time, and they can turn into these incredibly serious laws with incredibly serious penalties. And so that's just something, you know, I know, again, a lot of you know that, but it's interesting when you put it in a case and then you see how it actually works out. I taught law school for a little while, and all the law students would just like pass out when they saw this. So it's, and so do people when they're involved in these claims, right? So it's very concerning. So, okay, we won't stay on all the bad stuff, but for the government, so they have a lot of these cases, right? That's one case. They have a whole lot of these cases. They keep statistics on this. So at the very end here, right, is 2023. And they regulate healthcare through criminal laws, right? Civil laws with these civil financial penalties. The other stick that they have is exclusion. So if they think the conduct of the healthcare company is significant enough and it meets what is a law, there's exclusion criteria, then you as a company or individuals can be excluded from healthcare programs, meaning they cannot work somewhere that submits claims to the government. So that's another sort of, you know, that would take you out of working in healthcare, right? If that's been your experience all your life and then suddenly you can't do that. Interesting, in 2023, that, you know, this is tracking all False Claims Act recoveries, is 80% of those are from healthcare, and we've seen that over time, sort of more and more of these cases are from healthcare. And then 87% of those cases are from whistleblowers. So whistleblowers, remember, often come from your employees or your vendors, people that know something about your business and are concerned about something and tell the government and actually file a lawsuit to say, we think that that company has violated the law. So that's just a little bit of an overview. And then just to drill down a little bit on 2023 is, so those cases that we saw in the last graph, the government recovered $2.68 billion from those False Claims Act settlements. And that's $2.68 billion. And then that money goes back into the Medicare program. And then we talked about whistleblowers. They can get from 15 to 30%-ish. So, that's a moneymaker, right? You report this to the government, you follow that lawsuit through till it's settled, and then they get a portion of that. So if you were a whistleblower, the total paid to whistleblowers last year was $267 million. And the government tells us, like, the False Claims Act is one of our most important tools for rooting out fraud and for ensuring that public funds are spent properly and safeguarding our programs. And what they mean is, definitely, is they do take this money and they put it back in the Medicare fund. And we see at the bottom, I looked, the Medicare expenditures in 2023 exceeded 1 trillion. So they are always trying to sort of replenish if they feel like, that providers were overpaid. They benefit from having these large penalties on these settlements, and then just put that back in the Medicare fund. So that is how the world works.
Yeah, and I think the other thing we've heard, in the relative sort of recent, Karen, is that, just like everybody else, the government's understaffed. And so a lot of times they will rely, the fact that you can be a relator or a whistleblower is a way for them to have eyes and ears that they don't have the staff necessarily to do. And I think the ones that we look at and see are cases too, from a whistleblower standpoint, where people really have tried to go through the process of raising the issue internally, and for whatever reason have not felt that they've been effective at raising the issue internally. And then, always they're going to sort of be the bad actors, but I think the ones that you see come to fruition is you do see patterns of people trying to do the right thing, and organizations or individuals not adhering to the things that they've put in place. And then that's ultimately what then people say it's the last straw, and they call the government. So it's as much about the process and what you do every day, which Karin will get into, but they are effectively people out there that are eyes and ears for the government and have the pathway to do it. And this is, false claims goes back to what, 1860s? This goes back. And it's not specific to healthcare. It's just it's a fascinating history, but it's eyes and ears.
Yeah, for sure. And I think that's a great point, Tynan, because so many times that's part of the compliance program, right? Is having an effective way for people to report their concerns, and then making sure those concerns get investigated. And then you come back to that. And one thing, yesterday I was on a meeting with a lot of international compliance officers, which is kind of fascinating, but they have sort of global concerns that, luckily we don't have to think about those things. But one thing that they said, one of the speakers said 70% they had tracked of their compliance concerns that were raised were misunderstandings. So someone genuinely heard something in a meeting or saw just the way someone talked about it and was genuinely concerned that perhaps we were doing something wrong. The compliance, they had a very good process for investigations and getting back to that person and sort of showing them, like, hey, here's the part you didn't know, or let us show you these documents, how we do this. And she said, we just have been able to sort of, successfully put people's mind to rest. And then, of course, the other 30%, maybe those are actual problems that they need to address. But I thought that was interesting to say, gosh, that really is the majority of our work, hearing the concern, investigating the concern, getting back to the person. So you can't sort of underscore how important that is as a part of your program, I think. Sorry, I could go on for hours. We won't, we promise, it's an hour. So anyway, so the other piece of this we wanted to say is, okay, so we talked about the government having a playbook, right? And so in the U.S. Justice Manual, they and I put that there so you can see that, you know, they give prosecutors exactly procedurally, you know, what they should look at, what they should consider as they are going through the process. So the first thing they do is investigate, right? They might ask you for documents. They might ask to interview some of your employees. Once they feel like they have all the facts, they've reviewed your medical records, they have to make some decisions. And so in the course of working with, if you've ever been in that situation as a healthcare company or a practice and you've worked with the Department of Justice who's asked, or the OIG, who's asked you for some documentation, you know, one thing is, you know, the documents in your company, and just be sure to raise your hand if you're like, hey, I think this might be helpful for them to see or know about internally. And of course, do all this through the guidance of legal counsel. But prosecutors are going to look once they've investigated and say, should charges be brought? And then they're going to decide, should those just be civil charges, meaning the penalty will be money, or should there also be criminal charges? And you know, and they look at individuals as well, just so you know. I'm talking generally about the company's conduct, but they do look at that as well, an individual liability. And then they're going to look at, okay, so should a settlement be offered? And as I said, most of these do result in settlement. But when they're looking at the settlement, you know, they've got a range to consider. Okay, I've learned about this company, I've learned about what they do or what they have in place. And so how much should the financial penalties be? Like, how much should that multiplier be? 2 times, 3 times that amount of money? It adds up. The other thing is, does the conduct warrant, you know, monitoring or reporting going forward? So maybe they say, you know, they really need to be under a corporate integrity agreement, which is this other agreement that you would have with the Office of Inspector General. And just so you know who I'm talking about, sorry, I'll stop a second. The Department of Justice is the lawyer, and the OIG I view as the police for Health and Human Services. So the police, they can be detectives, they investigate, you know, they can be agents, they can come to your house and interview witnesses, but basically that's the police for Health and Human Services for Medicare and Medicaid. They make sure there's no fraud, and then they, you know, provide that information or work with the Department of Justice. So anyway, sometimes you hear from both, which is very alarming. So, but the OIG says, hey, I think going forward, I think they have such an immature compliance program. It's in its infancy, and we think we've got to monitor that they're strengthening that, and that they're auditing themselves and they're working on things. So that's when you'll see a corporate integrity agreement that really says they're going to have to continue to report for us for the next 3 years or 5 years. And then they decide, should the company just be excluded, right? Should individuals be excluded and not be allowed to participate in the program? That the conduct is so egregious that we think certain people shouldn't be allowed to submit claims anymore. So that's sort of what the prosecutor's doing in their head as they're evaluating you and the information that they're giving to you. And again, I'm simplifying this down. Now this we can all draw on, because this is also what they're looking at. And just pick your favorite crime show, because this is right. We know this is what they do. They look at the conduct. I mean, how pervasive was it? Did it go on for 10 years? Has it only been going on for 6 months? How serious was it? Was it just one physician contract, or was it all 200 in the company, right? So they're looking at the conduct. They're also looking at the response to the conduct. When you found out, what did you do? You know, did you immediately start to fix things or whatever? Or did you just kind of let this go for 12 months and then finally decide what to do? Then you came to the government. Confession, right? We know that's important. So did you immediately confess? Did you go through the, you know, the self-disclosure programs that are available? They look at priors, you know, they look, have you been before us before? Have you had a prior, you know, settlement agreement with us on this very same conduct? They look at your degree of cooperation. They look, you know, again, you should cooperate under the guidance of legal counsel. But they look to see, you know, if you're trying to sort of dive in and work with them. A lot of times, for instance, if you've worked with the government a lot, you'll say, look, will you let us do the investigation ourselves, and we'll give you the results. We promise to be transparent. And sometimes they'll let you do that. So that's an aside. Good faith. They're looking for, is your compliance program effective? So those of you that are compliance professionals, you might be like, no, look, I've got my plan and my work plan and my audit plan, and I'm doing all these things. So they're looking at that. And then they're looking at what corrective action, again, what did you jump in and do? Did you start, every healthcare provider I know, when something goes wrong, they start fixing stuff in their head. We should have done this, we should have done this. It's just very natural. So I think you'll usually have a lot to show there about, look, we got right on it. We got legal counsel. We started doing this to prevent whatever was going on. So you know what they're looking for because we've watched a little TV and we know. So, and then U.S. sentencing guidelines, just so you know, this is, again, something they look at. And this is one of the key things that they say they're looking for, an effective compliance and ethics program. And they say an organization shall exercise due diligence to prevent and detect criminal conduct. So that's what they expect your compliance program does, is that it prevents it and it detects it. And so that's, all those laws have criminal elements that we talked about. And so they're expecting you to prevent violation of those laws. And then they also want you to promote a culture that encourages ethical conduct, right? And a commitment to complying with the law. So that's allowing people to report, looking into things, what Tynan was talking about earlier. And generally you want to be able to show that it is an effective program. We'll talk about that in a minute too. So, so when you're looking, they're looking at these things, but I know you all look at this yourself, particularly compliance professionals or senior leadership, is do we have a compliance program, that fully covers all the things we're supposed to cover? Is it effective? Does it seem to be working? Or do we have, one of the things that sometimes when we work with clients is they expect you to have those laws, the requirements of those laws defined in written policies. Because if your employees don't know that that's a requirement, I mean, how would they follow it? And so the policies and procedures are really, I think when they start to talk to you about it, they want to see what's in place and they want to see that there's training, right? Tynan, I see you nodding your head. Yeah.
Yeah, because it's, it's one of those things you say, okay, well, we have a policy. Well, where's the policy? I mean, I remember with some things, the first question asked of, the government will be if somebody they're interviewing is, well, do you have a policy? The answer better be, yes, we have a policy. And then where is your policy? And then the answer should be, well, here's where I know where to go find the policy. And so the answers to some of those, what presumably innocuous questions at the beginning can really tell a lot about what you just shared, Karin, is the organizational culture, the commitment, the training. And so this is a living and breathing something every single day. And it's hard, admittedly, as Karin said, humans, treating humans, that this is not, we live in this day to day. This is what we do for our careers. If you don't live in it day to day, and we know a lot of you that are listening on the symposium are not folks that necessarily are in compliance every single day. And it's, if nothing else, the goal is just to raise the awareness and to help facilitate so that it can be a collective effort within an organization. And we'll kind of touch on that as we go along too.
Yeah, absolutely. And then I think a couple of things that we want to stress today, because I know some of you are in compliance and some of you are leadership. And so, it might be financial leadership, executive, senior leadership, or board members. And one of the things that they really talk about is oversight of the compliance program. Are those senior leaders really engaged in not just receiving the reports from the compliance officer every quarter, but really asking questions, being knowledgeable about the law, knowledgeable enough to sort of know some of the trends to ask questions. Are you asking, do they have the resources that they need? They might have a big fancy plan and then one person to do it. And so they need to check, do you have the systems you need, those kinds of things, and just being really engaged. I mean, that is definitely what they're looking for. Polling question number 1.
Thanks, you guys. Well, the first question up today is, the company's liability for violation of a health care law may be reduced if board members actively oversee the compliance program, repeated violations of this law in the past, no company compliance training in the past 2 years, the compliance work plan is outdated and not audited, or insufficient compliance staffing to complete work plan. And remember, you must fill out the polling questions to receive CPE credit. You will have 30 seconds to answer. Thank you for participating in our poll. I'll hand it back to our presenters.
Sharp group here, Karin.
Oh, yeah, they are. Boards members actively overseeing the compliance program, or senior leadership, I would say too, will reduce the liability for the company for sure. Let's see. Oh, sorry. Okay, here we go. So next, we're really going to talk about, so we talked a little bit about, you know, what the government expects of us and how they evaluate compliance programs. And what they have done for us finally is they have given us last year at the end of the year some general compliance program guidance to apply to all of us that are healthcare providers or operate healthcare companies. This is from the Office of Inspector General. And what it is there is this really, really good website that they have, and it has just kind of everything that you need on it. It's got links to other documents. So basically, used to be we had to shop for all this stuff. We kept all this all over our computer, from regulations to different manuals they'd given us, and this is all combined in one. So for those of you that haven't gone here, I'd take a look even while we're talking. It's sort of one-stop shopping to give you the guidance that you need for a compliance program, and then even for certain activities. We want to tell you some of the new things. Today won't be a comprehensive overview of every single thing in that guidance, but one thing we want to emphasize, if you haven't already added it to your work plan this year, is that patient safety and patient quality is now part of the compliance program, and they expect to see that as part of your work plan and things that you're auditing on. So if you haven't done that yet, we'd recommend that to you. And this compliance guidance, they will tell you, is voluntary. But again, what we just talked about is this is what they look at. This brings down your risk as a company. And so it's really important. It's a big financial risk. So this is a place to spend time in your company. And so anyway, this is a little bit about what that website is, and we recommend it to you for sure. We'll talk a little bit today about all that general guidance, but one thing that they did tell us is in 2024, they are going to begin giving industry specific guidance. So that's general guidance, and this will be specific. So look for this year they say they're going to issue 4 for hospitals, and that will be helpful to have specific guidance for hospitals. Clinical laboratories is a good example. I can imagine if some of you are trying to look at compliance from a lab perspective, that might not be an area you're super knowledgeable about, and so they're going to give specific information on that. Also, nursing facilities and Medicare Advantage, as we all know, is a big area. That's all the claims are getting submitted, so they're going to give specific guidance on that. So this is just a watch out for it. That is coming and should be helpful information. This is nothing new to all of you, but what we wanted to say in the compliance guidance is these are still they're using the same framework, just the 7 elements of a successful compliance program. We already talked about policies. We're going to emphasize throughout today leadership and oversight, training and education, having open lines of communication with the compliance officer. That's from an employee all the way to the board, right? Making sure there's a flow of communication about it. Enforcing standards, we're gonna have a little conversation. They've really talked about adding incentives to people that are bringing things forward, but also having consequences if somebody violates a rule over and over, right? Making sure there's a consequence. Risk assessment, auditing, and monitoring, we're gonna talk about that in a minute. And then again, as we said, when you detect something, how do you respond to it? Having corrective action initiatives. So the same framework that we all know is still in place. General themes that we saw in the new compliance program guidance is operational effectiveness. So, and they say not the structure, but Again, whatever you have in place, however small or however big you are, and they give some leniency for being a smaller practice. We didn't put this information in here, but it's in the guidance. It tells you if you're a smaller place or practice, here's some things that they understand, that might work for you. So be sure to look at that. But anyway, don't just have a plan on paper, make sure it works. That's something they're looking for. Also make sure that when you're doing the risk assessment, that note that it should change every year, right? It should be fluid. Like you have new risks, you're going to evaluate those. So they're looking for that you are actively updating your risk assessment, for instance. The compliance committee, we'll talk about their roles today, but they're really looking at, the compliance officer cannot do this by themselves. And they've recognized that. And they expect a compliance committee to be formed and to be active. And that should be members of several different departments in the organization. And they shouldn't just be another board that just listens to the compliance officer. They should be helping. They have actual roles that they should be doing. So it's something they've seen before that it's been ineffective, and they want the compliance committee to be active. And again, you see the same thing. There's a focus on high-level accountability from committee, boards, and owners. One of the things they've called out is private equity owners. And the criticism was that they said, okay, this is private equity owners, and they've been in other industries, and now let's perhaps purchased several healthcare companies. And what they found in some of the investigations is the private equity owners were not knowledgeable about healthcare. They bought into an industry and didn't know much about it. And so there wasn't an effective compliance. They weren't putting resources into it. And this is absolutely not all private equity, but I'm just telling you, this is the government is focusing on it because of some past experiences. And I would simply tell you that that's going to translate into always looking at the owners, the board, the senior leadership across the board, whether it's private equity involved or not. So anything, Tynan, you want to add on that? Okay. Okay, so now enough of me. Turn it over to Tynan, who's going to do the complicated stuff.
No, just a couple of things. I mean, I can't stress enough what Karin said about the website and access to it, and even the PDF. What she didn't say is it's a 91-page document, so it can be a little daunting, but it is very, very well organized, and you can click around and find different things. And of course, one of the things that I did was go in and look and see, okay, what are the things in here that could potentially affect the work that that we do on a day in and day out basis. And one of the things they've also done is they've sort of put some tidbits along the way of, okay, well, here's why we're asking you to do this. And there's one specific section in the regulatory piece, and I will tell you, this is page 12 of the 91. But they basically say that, organizations, individuals, and entities have to evaluate, they should evaluate arrangements that implicate the anti-kickback statute, and those that do not fit into a safe harbor by reviewing the totality of the facts and circumstances, including the intent of the parties. So they have really specifically said, here's what we expect you to do. They don't just leave it at that. They then give you some tools. And I think one of the really effective things that they did was this particular section gives you a whole list of questions effectively to ask. And it has a triangle with a, like warning sign that says, these are the things where we see the problems. And they go through, and for each one of these topics that's listed here, they give you a question to ask yourself. And, one of the things we did is we have several tools which, we are happy to share, but we often find checklists are a really great way to communicate how to assess risk. And so we've got one that's for medical director needs assessments. We've got one for commercial reasonableness. And interestingly, a lot of the things that we had in our checklist were things that were on here, which was, good for us, because that says to us the things that we are advising clients and are telling people they need to be aware of were the same things that the government has said. Here's, if you've got to prioritize, here's where you need to prioritize. So a couple of things just to hit on is they're really focused on the degree of influence and referrals. So looking at the nature of the arrangements, how were people for an arrangement selected? How did you make the decision to hire this doctor or to offer this doctor compensation or to buy this physician's practice or to enter into this management services agreement? Always the way that the compensation or remuneration is determined will get looked at. And is it consistent with fair market value? So fair market value continues to be a big issue, and then commercial reasonableness is a big issue. Is there a legitimate, reasonable, documented, supportable story for why you entered into an arrangement? And so that gets back to sort of what are the facts and circumstances. They also talk about what are the items and services that are going to be provided to make sure that, you know, they are in fact reasonable and aren't something that's just being purchased or procured for, you know, in return for those referrals. Karin, you can go to the next slide.
Okay.
And then a couple of other things, you know, they've thrown in some, you know, vernacular, sort of industry vernacular too, is, you know, they're asking people to think through as they're focusing on these arrangements, what's the impact? What is the impact to the federal program, to Medicare, Medicaid going to be? Is this going to incent overutilization? Is it going to, you know, raise costs? Steering, you know, they actually in here use the term, you know, cherry picking and lemon dropping. And so, you know, they want to make sure that these types of arrangements are, the people that are entering into these arrangements are being good stewards of the dollars that are being spent by the government. And again, no surprise, but conflicts of interest, we continue to see that come up. We see that a lot in the area of physician-owned distributorship, other places. And then the manner in which the arrangement is documented. So that gets back to sort of that number one of the 7 elements is it written, is it documented, and then is it followed? So the one other page in there, and I went from like the beginning of the document to the end of the document, Karin, to the next slide. This is page 80. And this was also really interesting to us because if you, in the fine print, if you go about halfway, maybe 2/3 of the way down this paragraph, they actually say entities should consider what type of centralized arrangements tracking system to establish. So they are suggesting effectively that organizations have some kind of centralized arrangement that they're tracking. They also, you know, they don't say you have to do it this way or that way. They say, you know, think about the size of your organization and what makes sense. But you do need to have some way to centralize, support the documentation, review the documentation, include supporting documentation in that centralized area, or have it be able to be found easily. And I think that's the key is, you know, a little bit off track, but when we go and we look at some of the things that are coming out of COVID and COVID, you know, enforcement, a lot of it is related to what? Documentation. And in the heat of the moment, people aren't documenting, people leave, people come, there's a question that could be a perfectly reasonable, logical, you know, inadvertent question, but there's no documentation. So it's really, really what's old is new, document, document, document. Keep your policies and procedures and pay attention to some of the nuanced language that they've included in here.
And I will say, Tynan, I know you've seen this too, is just this is a practical point, is when people are transitioning either out of the company or they've gone on leave, is probably the most practical advice is just to make sure, you know, you've gone back and tick and tied as well as you can. Do you have all the documentation you need for that person before they leave? It's always crazy when there's transition times, but so many times there's a historic loss of information, right?
Yep. It's that, and it's organizations that are more decentralized. So, you know, the bigger you are, the more decentralized, potentially the more decentralized. And I think that's where we found it's human. It's not intent. Oftentimes it's what somebody I heard on a podcast recently say is sloppiness. It's inadvertent sloppiness and just not keeping up with it. So.
Yeah.
Okay, so I think just a little bit more on the financials. We touched on this before. Is, you know, following the money is always going to be key. So if you're paying somebody, being able to follow, what are you paying them? How are you paying them? Did you pay them according to the contract? They hit a little bit more on private equity here as well. And regular coding, regular reviews of billing and coding practices. I think that's something for a while. It's not that it went away, but we didn't see as much, at least from a consulting. I'd say maybe 5 years ago, it was not nearly. We weren't getting nearly the requests for billing and coding audits from private practices, from hospitals and health systems. I think that there's been a big uptick in that work, and so I think that's indicative of what the government has been focused on. Mm-hmm. So I think that might bring us to our next polling question.
Yeah.
Fantastic. Thank you so much. The next question is, what is not included in the OIG's compliance program guidance? Patient safety and quality are part of compliance. Companies should evaluate physician-hospital arrangements. Compliance committee must be active and engaged. Compliance officer should not report to the legal department, or the hospital cafeteria menu. You will have 30 seconds to answer the polling question. Thank you so much for participating in the poll, and I will hand it back over to our presenters.
Oh, thank you so much. Let's see here. There we go. Okay, sorry. So we want to talk a little bit, just to wrap us up, sort of the best practices we said we'd talk about, and the government's, kind of tying in the government's expectations for an effective compliance program. So what does that look like in practice? One of the most important things that they stressed in the new compliance program guidance was a risk assessment. So the OIG does a work plan every year where they say these are the risks that we're going to sort of monitor. You want to mirror that same process. Annually look at what are our current risks that we need to work on this year. They might be new risks. You might know that a new law has just come into effect, and that's something you need to operationalize and have policies around and training. You might want to remove risks. Like, you don't necessarily want to keep things on there all the time, or your plan's going to be huge. So you're like, oh, we've operationalized that. We've got that. Our audits are showing good effectiveness. That one comes off. And then at the end, whatever your list is for that year, you want to rank it and sort of say, this is high priority and low. And I say this because this is what will happen, right? Something will happen this year that is not on the work plan. Some new law will come into effect. Some audits, a trend of audits come up, and everyone gets sort of overwhelmed with that. You're going to need to slide things in on this plan. And so you need to know the ones at the bottom that maybe can get sort of moved off the priority list based on the adjustment. So this is sort of your core annual risk assessment, know your company's risks. The compliance committee, again, I'll just say, has a responsibility for that. They want to see them sort of using, like, if you all have done enterprise risk management, that's a framework you can use. They will, the compliance guidance emphasizes some really core issues that they expect are common compliance risk areas. It's what we've talked about today. Billing. I will say something about sales and marketing. Whenever someone comes to try to sell you something and says, oh, you should use this, home monitoring kit that we've got, and use this code, bill it under this code, do not run. Do not take that advice. This is a fraud area, and the government is very big on sort of salespeople, marketing people that are tying a device that they're selling to a code that you can bill. Quality of care, we talked about that, but again, these are the sort of the things that they emphasize as common risk areas that should be at least evaluated to be part of your plan. So once you've got the risk plan, you want to have a plan to mitigate that risk, and then how do we measure the results, right? How are we doing as we go? So this was just an example. Your compliance work plan is, I've got the risks, here are ways, strategies that we can mitigate that risk. And then tied to that strategy, and these were just examples of things that could be on your work plan, but tied to that strategy will be an audit plan. How are we going to measure it? And then how often will we analyze that? And then, do we need to revise our plan? So this is all sort of a, all has to work together. The OIG toolkit on measuring compliance program effectiveness, I've got that at the bottom of the audit plan. That's a very, very helpful document to let you, give you some ideas about how to measure. Because sometimes I think we have several folks in our company that are very good at auditing and monitoring. I think that's sometimes a challenging thing to figure out how to do that. Reporting, this is those of you that are in compliance a lot, the compliance guidance is really looking to make sure you've got an organization that reports up and down, right? So an employee will feel comfortable addressing concerns, and that you're reporting all the way to the board, and just there's a flow of information through compliance, right? They also really emphasize compliance officer reporting to the board committee. These are the kinds of things that they would look for a compliance officer to report. Issues that are trending up, maybe issues that are trending down that you've been able to mitigate, but things they should watch out for, new risks, and then also updating the board when there is a violation of law, when something has happened. We've seen that before, when somebody maybe just sort of keeps it to themselves and works it through compliance a little too long, when it really needed to be reported to senior leadership and the board. So they want to see that. There's a little bit in the new compliance guidance about compliance officers, and I think the main takeaway there is really to say the compliance officer should not have a role in finance, in legal, in the business operations, or clinical. So their role should be compliance. They should also not really be doing risk management. But their goal is to operate, run the compliance program, and advise the leaders of the risks, and and oversee that audit plan, and just continually working the compliance plan. Also emphasize they should have the same authority as a senior leader. There's somebody that should report directly to the CEO and the board, and be given sort of that authority to tell the company what's going on. On the side here is just key risks. We've talked about a lot of these already today, but in the compliance guidance, but also we happen to be in the Healthcare Compliance Association. We were presenting, the OIG was presenting as well in April in Nashville. And so one of the OIG senior counsel was there, and these were things she really emphasized, right? The role of the compliance officer, here's key risks they will be focusing on as the OIG. So it mirrored the compliance guidance, but it was nice to hear from her exactly what she is looking for. There's no question that these were the things sort of in their mind. Some of this is repeats again, but we wanted to sort of say these are big things in the compliance guidance that we would look for. One of the things I mentioned a little bit earlier was they are looking for the compliance officer to be there, to be at the board quarterly. So, and that there should be time reserved for an executive session where the compliance officer can meet just with the board without other officers there, in case you need to say the CEO is not doing a good job, or that's actually the culprit, or whatever, but that you can have a private session. And again, they really have emphasized the compliance committee's involvement in the risk assessment process. So again, not leaving it all to the compliance officer. And then I know I keep saying sort of the same things over and over, but this is again from the OIG. These were duties that she wanted to make sure the compliance committee members knew, that they should attend, they should actively participate, right? But interestingly, they really had a lot of conversations about what I'd call the carrot and the stick. But on the stick, they expected performance evaluations. If you're a compliance committee member in your organization, but performance evaluations to be impacted. If you are not doing your job and you're not sort of carrying forward the torch of your role in the compliance committee, then you shouldn't get a bonus, or it should be reduced, or your raise should be reduced. They want to see that there is a consequence there. They've also added sort of this concept of incentives. If people come forward, I think I mentioned that, maybe they should get compensation, or maybe they should just get recognition. I'd probably go with recognition on that. That's just me. But anyway, board members, she also went over duties. So again, from the OIG, and this is one thing I really would recommend to everybody that's in a senior leadership position or on a board, is the practical guidance for healthcare boards on compliance oversight. I think that's been around. I'm probably going to have the wrong year, but I'm not even going to say the year because I'm sure it's wrong. But anyway, it's been around several years. It's super helpful. It tells you exactly what they expect of board members, and I would recommend that to everybody. And again, the OIG said, we expect you to be knowledgeable about the laws. We expect you to make sure there are sufficient resources for compliance programs and officers to maintain the program. So sort of the same thing we heard before, but this is what they emphasize. And the final note I think that we really wanted to say is, this is, again, if we go back to what the prosecutors or the U.S. attorneys are looking at, one of the things they're looking at is minimally required is the organization's governing authority shall be knowledgeable about the content and operation of the compliance and ethics program, and shall exercise reasonable oversight with respect to the implementation of that program. And that high-level personnel, so that could be senior leaders, shall ensure that the organization has an effective compliance and ethics program as described in this guideline. And so again, that is, you can tell I've hit some of the same things just over and over and over today. But I think that you can tell that that's how important those things are from the government's perspective, and how they'll evaluate your program. And I think that puts us to polling question number 3.
Thank you so much. The next question is, board's compliance responsibilities do not include obtaining knowledge about compliance risks and topics, reviewing compliance risk assessment reports, asking questions about how compliance operates, requesting information or training on compliance issues, and conducting compliance audits personally. Remember, you must fill out the polling questions to receive CPE credit. You will have 30 seconds to answer. Thank you for participating in our poll. Now I will hand it back over to Karin and Tynan.
Oh, I think Tynan, last notes?
No, I think this is just good tips, good information, and your bedtime reading, beach reading is the general compliance program guidance. But you can select the areas you want to tackle first. So, but we really appreciate your attendance and taking the time out of your busy schedules and days to join us and to participate in our summer symposium. I think that's all we have.
Well, thank you so much to our presenters. If you have any questions, their presentations and contact information will be emailed to you along with a recording of today's event. Also, if PYA can provide assistance with audit, tax, compliance, valuation, or transaction services, please call or email us. You may also visit our website at pyapc.com for more details about our specific areas of expertise, or to subscribe to receive PYA insights. Please remember to stay on the line once the webinar disconnects to complete a short survey for CPE credit. Your CPE certificates will be emailed to you in 1 to 2 weeks. Now I'll hand it back over to Catherine to close us out.
Thanks, Caitlin. On behalf of PYA, thank you for joining us today. We hope to see you tomorrow for day 2 of the Summer CPE Symposium, where our presenters will share with us an annual accounting and auditing update and share some information about critical pathway information technology and how to prepare for a cyber disaster. We hope you'll join us, and we hope you have a good rest of your day. Thank you.